Hey everyone, Dr. Mike here. Welcome to the channel. You know I'm passionate about giving you the information you need to live your healthiest life, and that includes taking care of yourself and your family during pregnancy. That's why today, we're talking about a topic that's close to my heart: high-risk pregnancies. If you or someone you love is expecting, this video is packed with vital information you need to know. Pregnancy can be a magical journey, but it's essential to be aware of the factors that might require a little extra care. Don't worry, we're going to break it all down in a way that's easy to understand, and, hopefully, even a little bit reassuring. So, grab yourself a comfy spot, maybe a cup of herbal tea, decaffeinated of course, and let's dive right in. First up, let's talk about multiple pregnancies. Now, while the idea of having twins or triplets might seem extra special, and trust me it is, it also means we need to bump up the monitoring. Why? Well, carrying more than one little one puts extra strain on your body and increases the chances of certain complications. One of the biggest concerns with multiple pregnancies is preterm birth. This basically means the babies might decide to make their grand entrance earlier than expected, which can lead to some health challenges for the little ones. But don't worry, with careful monitoring and prenatal care, we can significantly reduce those risks. What does that monitoring look like? Well, your doctor will likely recommend more frequent ultrasounds to keep a close eye on the baby's growth and development. These ultrasounds are like little windows into your womb, giving us a clear picture of how the babies are doing. You might also need to visit your doctor more often for checkups. I know these extra appointments might seem like a lot, but trust me, they're crucial for ensuring a healthy pregnancy for both you and your babies. It's all about staying one step ahead and catching any potential issues early on. Next, let's address a condition that can pop up during pregnancy called gestational diabetes. This type of diabetes is unique to pregnancy and usually goes away after you give birth. But even though it's temporary, it still requires our attention. Now, you might be wondering, what exactly is gestational diabetes? In simple terms, it means your body isn't processing sugar as efficiently as it should during pregnancy. This can lead to higher than normal blood sugar levels, which can affect both you and your baby. Medical expert, media group, medical expert talking to camera, doctor reassuring pregnant woman, doctor in medical office at stock at distribute _ The good news is that gestational diabetes is very manageable, especially when we catch it early. Most women with this condition can control their blood sugar levels through diet, exercise, and close monitoring. We're talking about incorporating healthy carbs, lean proteins, and plenty of fresh fruits and veggies into your diet. And of course, regular physical activity is key. Remember, every pregnancy is different, and what works for one person might not work for another. That's why it's so important to work closely with your doctor to create a personalized plan that's right for you. Chapter 3. Preeclampsia, Recognizing the Signs and Taking Action. Now let's talk about a condition called preeclampsia, which is a little more serious but still very manageable with the right care.
Preeclampsia usually shows up after 20 weeks of pregnancy and is marked by high blood pressure, sometimes accompanied by protein in the urine, and often swelling in the hands and feet.
It's important to catch preeclampsia early because if left untreated, it can lead to serious complications for both mom and baby. That's why those regular prenatal checkups are so crucial. They allow us to monitor your blood pressure and catch any red flags early on.
The exact causes of preeclampsia are still a bit of a mystery, but researchers believe it might be linked to problems with the placenta, the organ that nourishes the baby.
The good news is that with early detection and proper management, most women with preeclampsia go on to have healthy pregnancies and deliveries. Now, I know this might sound a little scary, but remember, knowledge is power. Being aware of the warning signs and knowing when to seek medical attention can make a world of difference. Chapter 4. Pregnancy after 35. Embracing motherhood at any age. Finally, let's talk about pregnancy at an advanced maternal age, which typically refers to women who are 35 years or older when they conceive.
Now, I know what you're thinking. Dr. Mike, you're making me feel old. But trust me, age is just a number, and many women have healthy pregnancies and babies later in life.
However, it's true that the chances of certain complications, like chromosomal abnormalities, do increase slightly with age. But don't let that scare you. With the right prenatal care and monitoring, we can manage these risks effectively.
Your doctor may recommend additional screenings or genetic testing. just to be on the safe side. These tests can provide valuable information about your baby's health and help you make informed decisions about your pregnancy.
Remember, every woman's journey to motherhood is unique. Whether you're a first-time mom at 20 or starting a family at 40, the most important thing is to have open communication with your healthcare provider and advocate for the care you need. So, we've covered a lot of ground today, and I hope you found this information empowering rather than overwhelming. Remember, knowledge is power, and understanding the ins and outs of high-risk pregnancies can help you feel more in control of your journey. The most important thing is to work closely with your healthcare provider, ask questions, and address any concerns you might have. They're your partners in this incredible journey, and together, you can make the best decisions for you and your little one. Thank you so much for joining me today, and don't forget to like, subscribe, and hit that notification bell so you never miss an update. Until next time, stay healthy and informed.